Hello, I'm Pat Mallory. Today I'm going to talk about stem cell therapy. I've been doing stem cells in my practice for about 5 years, started in 2007, and since then I actually completed a fellowship that's underwritten by the University of South Florida in stem cell and regenerative medicine. Stem cells are amazing cells that we all have in our bodies until we die, and they are unique from other cells in a couple of ways. First, they perform something called asymmetric cell division. What that means is they can literally generate new tissue in an area of tissue that's damaged in the body. The other way that they work is through a unique system of cell signaling, which means communication with other cells in the body, that stimulates healing. This signaling process or communication is a two-way communication. These cells respond to cells in tissue that is damaged, and this communication can happen locally in the area where the stem cells happen to be, but it can also happen across the body from distant areas in the body. The stem cells can be accessed most easily from either a patient's fat or their bone marrow. Because of rules from the FDA, there are limits on some of the uses of stem cells and procedures, and so this limits us to using a patient's own stem cells, harvesting them from their tissue and returning them to them in the same procedure, which means on the same day. There are some clinics that offer products that are claimed to have stem cells in them. These products might come from amniotic fluid or placental tissue or umbilical cord blood. And because of the FDA rules, these products have to be processed in such a way that the stem cells in them are actually non-viable. And that limits how the stem cells work and makes them considerably less effective than live stem cells that we access from the patient's own tissue. Stem cells have been used to address quite a number of different conditions. Most commonly they're used for musculoskeletal problems that patients deal with, most commonly arthritic conditions, osteoarthritis. They have been shown to be of benefit in even advanced, what they call bone-on-bone arthritis, that could be affecting knees, hips, and other joints. There's quite a list of other conditions for which stem cells have been used and have been shown to be beneficial. Those include COPD or emphysema, multiple sclerosis, brain injuries, stroke, back and neck injuries, and wounds that don't heal very well, such as decubitus ulcers or pressure ulcers, or wounds that diabetic patients and other seriously ill patients sometimes develop. For the purpose of my talk today, I'm going to be focusing on stem cell treatments to address osteoarthritis. The process for providing stem cell treatment begins with a consultation and an evaluation of the problem that the patient might be dealing with. In this process, we take a history, examine the patient, review prior treatments, imaging studies, all the things that have been done for the condition that the patient has. There might be additional testing that hasn't been done that we might recommend, and we will come up with a list of options for the patient, which sometimes include treatments that might be provided before or instead of stem cell, or things that we might recommend the patient do in addition to stem cell therapy. Once that process has been complete, if the condition seems like it's something that would be amenable to stem cell treatment, then the patient schedules for a stem cell treatment in the office. On the day of a patient's stem cell treatment in the office, we harvest bone marrow from their iliac spine, which is a bone just below the belt line on the back side. That process takes about 5 to 10 minutes. Once the bone marrow is collected, there's a lab process to concentrate that bone marrow. Our protocol is to combine the bone marrow concentrate with platelet-rich plasma, which is something we make from the patient's own blood. Once those two products have been made, injections are then performed into the area that we're treating. And my protocol is also to inject a small portion of the bone marrow concentrate, stem cell concentrate, into the patient's vein. The intravenous injection maximizes some of the cell signaling pathways that I referred to earlier. Following the patient's initial bone marrow aspiration and stem cell injections, my protocol is to repeat PRP injections into the affected area. We provide at least 2 of those in the first 6 months following their initial stem cell injection. The reason that we combine PRP with the stem cell concentrate and provide at least 2 additional PRP injections is that platelets in PRP also stimulate healing through cell signaling pathways similar to the ones I mentioned earlier. PRP can be used by itself for a number of conditions. If you have interest in hearing me talk more about PRP, there is a separate video in which I cover that. Patients tolerate the bone marrow aspiration and stem cell injections very well. They typically have very minimal pain following these procedures. If there is pain, most commonly it is at the site of the bone marrow aspiration, but it's mild and it's usually resolved within 24 to 48 hours in most cases. Following the treatment, we don't impose any physical restrictions or limitations on the patient beyond what they already are self-imposing based on their pain. Gradually over time, as the stem cells begin to promote healing, the patient is able to gradually increase their activity and normalize their function. In order to maximize someone's response to stem cell treatments, we frequently will recommend that they work with a physical therapist. With a referral to physical therapy, that treatment most commonly is covered by insurance if the patient has insurance. Benefits of working with a physical therapist are several-fold. First, the physical therapist is able to assist with exercises and other things that help to rehab the body part that we've been treating. Second, the physical therapist is able to assess for, identify, and hopefully correct any compensatory changes in gait and movement that the patient has developed over time in a way to compensate for their pain. In other words, many patients who have had chronic pain in the knee, for example, may have changed how they walk. They favor that knee. They limp. Sometimes that becomes such an ingrained part of their walking pattern that unless it's identified and corrected through physical therapy, that pattern will persist and may cause other problems in the future. The third value of working with a physical therapist is they provide a separate, independent, objective set of eyes to monitor the patient's progress so that the patient doesn't have to simply rely on their subjective assessment of improvement in pain and so forth. Physical therapists can actually take measurements of range of motion, strength, and other indicators before treatment and over time following treatment. And these measurements are very helpful to the patient as well as to the physical therapist in monitoring their progress and showing progress. Maximal benefit from stem cell treatments might take months, perhaps even a year or more, for the patient to notice final maximal improvement. However, the improvement starts in the first few weeks. Most patients, even 1 month after their initial stem cell treatment, are very aware of improvement and usually are quite happy with what they're seeing at that point. As I mentioned before, there are many other conditions besides osteoarthritis that stem cells have been used for and have provided great benefit for. Full discussion of all of those conditions is beyond the scope of a short video like this. However, if you have any of those conditions or any that you are interested in speaking to someone about regarding possibility that stem cell might be a good option for you,